Imagine this. You're sitting in your favorite chair, sipping coffee, thinking about what's for dinner. Suddenly, a tightness in your chest. It spreads. You feel dizzy. You try to speak, but the words don't come out. 5 seconds later, your life has changed or ended. Now tell me, when you hear the word heart attack, what comes to mind? Most people would say cholesterol, clogged arteries, too much butter. But here's the truth, one that may shock you. Over 80% of heart attacks and strokes are not caused by cholesterol. They're not caused by calcium buildup either. They're caused by something far more sudden and far more dangerous. A clot, a tiny mass of cells and protein that forms in your blood and blocks the flow in just seconds. And when that happens, there's often no warning, no second chance. Now think about how often you've been told to watch your cholesterol. How many low-fat diets have you seen advertised? How many statin prescriptions have been written? Millions, maybe billions? But what if the real threat isn't plaque that builds up over years? It's a clot that strikes in moments. What if the system has been focusing on the wrong villain all along? If you've ever lost someone suddenly, if you've ever known someone who seemed healthy and then collapsed without explanation, this message is for you, because today we're going to uncover the real story behind heart attacks and strokes. Not just the surface level story, but what's really going on inside your arteries. You'll learn what a clot is, why it forms, what triggers it, and most importantly, how you can take control starting today. This isn't about fear, it's about freedom. Freedom from confusion, freedom from silent threats. And if you stay with me, you'll understand how your body wants to protect you. You'll understand how to help it do just that, not with prescriptions, but with choices. Because your heart doesn't just beat, it speaks. And today we're finally going to listen. The truth is, most people who die from a clot never see it coming. They don't get a warning. They don't feel a buildup. They don't get to say goodbye. 1 minute they're talking, walking, smiling. The next, it's over. That's why understanding what causes these clots, how they form so fast and so fatally, is not just helpful. It's urgent. Because when the clock starts ticking, 5 seconds is all it takes. Let's break it down. What exactly is a clot? At its core, a blood clot is your body's emergency repair crew. When you cut your finger or scrape your knee, platelets rush to the scene. They clump together, sealing the wound. That's clotting, and it's life-saving. But inside your arteries, when there's no cut to fix, that same process can turn lethal. Imagine your blood vessels like a highway. Cars are moving smoothly. Oxygen, nutrients, immune cells, all traveling to where they're needed. But then suddenly a pile of debris appears. Traffic slams to a stop. That's what a clot does in your bloodstream. It creates a sudden, total blockage. Now you might be thinking, but isn't that what cholesterol does too? Not exactly. Cholesterol builds slowly over time. It narrows the arteries, yes, but usually not enough to stop blood flow completely. Think of it like slowly adding bricks to a wall. It becomes a problem, but the blood can often still get through. A clot, on the other hand, is instant. It forms in response to a trigger, an injury, a toxin, an infection, even emotional trauma. And within seconds, it can shut down an entire artery. That's why so many heart attacks and strokes are sudden. Not because the arteries were full of cholesterol, but because a clot sealed them off like a cork in a bottle. Now here's the part most people don't know. The clot itself isn't always the core problem. In many cases, it's responding to damage inside the artery wall. A tiny injury, a microscopic tear. That's what starts the cascade. Your body tries to patch the hole and sometimes overreacts. The clot forms, the artery closes, and the heart, starved of oxygen, starts to die. This process doesn't take hours. It doesn't take minutes. It can happen in less than 5 seconds. So no, it's not always about cholesterol. It's about the clot and what caused it to form in the first place. That's the real danger. And that's why we need to stop looking at fat and start looking at inflammation, triggers, and daily habits that silently damage our arteries from within. Because if we don't, we're not preventing heart disease. We're just guessing and hoping we're lucky. But luck isn't a strategy. Understanding is. That's the thing about clots. They don't knock. They don't make noise. They don't give you pain ahead of time. They don't wait until you're ready. One moment, your heart is pumping. The next, it's starving. You might feel fine. You might feel strong. And still, it can hit you. That's why the scariest part isn't the clot itself. It's that you won't feel it coming until it's too late. We've been told to fear fat, to avoid butter, to cut back on red meat. But the true triggers of clot formation, they're often hiding in plain sight, and they have nothing to do with cholesterol. Let's walk through what really sparks a clot and why so many people never see it coming. 1. Cigarette smoke and environmental toxins. The number one known trigger of clotting is not cholesterol. It's inhaled smoke. Cigarette smoke is loaded with chemicals that damage the inner lining of your arteries, creating microscopic wounds. That damage signals your body to form a clot. And it's not just cigarettes, air pollution, chemical exposure, even secondhand smoke, they all inflame your vascular system. 2. Alcohol. We often think of alcohol as harmless in moderation, but to your liver, alcohol is a toxin. Once processed, it enters the bloodstream and can irritate the inner walls of your arteries. Over time, this inflammation contributes to clotting risks. 3. Hormonal changes. Birth control pills and hormone replacement therapy are widely prescribed, especially to women over 50. But few people realize these hormones can increase clotting factors in the blood, raising your risk for both stroke and heart attack. 4. Surgery and extreme physical stress. Surgery triggers inflammation. The body reacts as if it's under attack, and part of that response is clotting. Even extreme endurance sports like marathons, though healthy in some ways, can stress the cardiovascular system to the point of increasing clot risk. 5. Refined sugars and high carbohydrate diets. Processed starches create inflammation in your arteries. In diabetics, this becomes especially dangerous. High blood sugar makes the blood more viscous, stickier, raising clot risk by up to 5 times. It's not just what you eat, it's what it does inside your blood vessels. 6. Infections, especially hidden ones. Chronic infections like gum disease, root canal abscesses, or even infections from the gut can leak bacteria into your bloodstream. Once there, that bacteria can latch onto artery walls and spark clotting. That's right, poor oral hygiene can put your heart at risk. 7. Emotional trauma and grief. We'll go deeper into this soon, but let's just say the stress from losing someone you love isn't just emotional, it can be deadly. 8. Excess calcium. Most people think calcium is just for bones, but in high doses, especially from supplements, calcium can trigger clotting. It plays a role in over 15 clotting mechanisms in the body. Postmenopausal women who take high-dose calcium supplements are at increased risk for heart attacks and strokes because the calcium doesn't always go to the bones. Sometimes it hardens in the arteries. Let's pause here. Do you see a pattern? Most of these triggers aren't about what you weigh or how much fat you eat. They're about what inflames you, what stresses you, what injures your arteries from the inside. And that's why the people who seem healthy on the outside can still collapse from a clot. It's not about how you look. It's about what's happening silently underneath the surface. Once you understand that, the path to prevention becomes clearer. And the first step is to stop fearing cholesterol and start fighting inflammation. Here's something that sounds poetic, but it's medically real. You really can die from a broken heart. It's called Takotsubo syndrome. And it's not just rare, it's rising. After losing a spouse, a child, a lifelong friend, your heart doesn't just feel the pain, it responds, it spasms, it can fail. And for men, the risk of dying from this stress is double that of women. So yes, grief can absolutely break your heart, and sometimes it never gets the chance to heal. You've probably heard someone say, she died of a broken heart. Maybe you even knew someone it happened to. It sounds poetic, tragic, but is it real? Yes, and medicine has a name for it. Takotsubo cardiomyopathy. It happens when a wave of extreme emotional stress, like losing a loved one, going through a divorce, or even receiving shocking news, sends your nervous system into overdrive. Your body floods with stress hormones. Your heart spasms. The left ventricle weakens and balloons. To doctors, it can look just like a heart attack, but when they check your arteries, there's no blockage. The heart is just overwhelmed. Let me paint a picture. A man loses his wife of 40 years. The next day he collapses. No cholesterol issues, no warning signs. What happened? His heart broke, literally. And studies now show that men are twice as likely to die from this condition as women. Even though 90% of cases happen in women, men are more likely to experience the fatal form. One study found that after a major loss, your risk of dying increases by up to 70% in the first 6 months. Another showed that people who experience deep, long-lasting grief are 88% more likely to die during that time. And it's not just humans. Animals do this too. There are stories of dogs refusing to eat after their owners die. Geese who waste away after losing a mate. Why? Because grief doesn't just live in your mind. It travels through your nervous system, your hormones, your blood vessels, and yes, your heart. Now here's what makes this even more dangerous. This kind of stress often goes untreated. No one sees it on a scan. It doesn't show up in blood work, but it silently alters how your heart beats, how your blood flows, and how your arteries respond. It creates the perfect storm for a clot, and that's why emotional trauma can be just as deadly as a poor diet or smoking habit. So if you've lost someone, if you've felt that deep, aching pain in your chest, you're not imagining it. Your heart remembers, and if you don't give it space to heal, it may give out when you least expect it. But healing is possible, and in just a moment, we'll look at the simple, natural ways you can begin. It sounds strange, doesn't it? That something hiding behind your teeth could threaten your heart? But the science is clear. The same bacteria that causes gum disease and infections in your mouth has been found inside artery walls where it doesn't belong. It doesn't just stay in your mouth, it travels, it inflames, it sets the stage for clotting. So yes, your toothbrush might be more powerful than your blood pressure meds. Now that we understand what a clot is and what really causes it, it's time to talk about what you can do. Because you don't need to live in fear. You need to live with intention. Let's start with what your body already knows how to do. Heal. Your body is equipped with mechanisms to prevent unnecessary clotting, to calm inflammation, to keep your arteries smooth and clear. But it needs the right materials, the right inputs, not drugs, not extreme diets, just a few daily practices that support the healing process. Here are the natural tools your body needs, starting today. 1. Vitamin K2, the calcium traffic cop. Most people know about vitamin D, but vitamin K2 is just as vital, especially for the heart. It tells calcium where to go, into your bones, not your arteries. Without K2, calcium can build up in soft tissues, especially if you're taking calcium supplements. That buildup stiffens the arteries and increases clot risk. You'll find K2 in full-fat dairy, egg yolks, grass-fed butter, and fermented foods like natto. And yes, those are the very foods many people were told to avoid. 2. Vitamin D, your arteries' anti-inflammatory. Vitamin D does more than protect your bones. It also helps regulate immune response and reduce vascular inflammation. It works best with K2. Together, they act like a team. D reduces inflammation. K2 directs calcium. Low vitamin D has been linked to higher clot risk, stroke, and heart disease. And where do we get it? Sunlight. 10 to 20 minutes a day, early morning or late afternoon, can do more for your arteries than a shelf full of pills. 3. Magnesium. Nature's heart relaxer. Magnesium helps keep your heart rhythm steady and blood vessels relaxed. It also prevents calcium from depositing in the wrong places. Low magnesium is common in older adults, and it's tied to arrhythmias like atrial fibrillation, which itself can lead to clots. 4. Nitric oxide, your body's natural blood thinner. This molecule helps your arteries expand, lowers blood pressure, and reduces clotting. How do you boost nitric oxide? Eat leafy greens and beets. Avoid antiseptic mouthwashes that kill the bacteria that help produce it. Breathe through your nose. Get some sun. Move your body. Even humming can help. 5. Enzymes that break down clots naturally. Certain enzymes like nattokinase, serrapeptase, and bromelain can reduce excess clotting. They work best when taken on an empty stomach. You may not need them every day, but they can be powerful allies, especially if you're at risk. 6. Fasting and low-carb eating. Both fasting and ketogenic diets help lower inflammation and reduce blood sugar. Two key players in clot formation. Fasting also triggers a cleanup process called autophagy, which helps clear out damaged cells and proteins. 7. Garlic and onion. These humble kitchen staples have powerful anti-clotting and anti-inflammatory properties. Fresh is best. Chop them, crush them, cook them, but make them part of your life. 8. Oral care isn't optional. Brush gently, floss daily, clean your tongue and avoid sugar. A healthy mouth means a healthier heart. 9. Sleep, recovery, and emotional balance. Stress is one of the most powerful triggers of clotting. You can't remove grief or hardship, but you can give your nervous system time to recover. Meditation, gentle walking, time in nature. These aren't luxuries. They're medicine. So no, you don't need to fear clots. You need to understand them. You need to respect what your body's trying to do. And with a few small shifts each day, you can protect your heart in ways that pills simply can't. You might be thinking, I'm too old for this to matter. But let me tell you, your body hasn't given up. Even now, it's working to protect you, to repair what's been damaged, to keep you going, one heartbeat at a time. And the moment you give it the right support, healing begins. Whether you're 60, 70, or 85, it's never too late to protect your heart. It's never too late to start again. We've come a long way today. We've talked about clots, how fast they form, how deadly they are, and how misunderstood they've been. We've talked about triggers most people never consider: grief, infection, sugar, hidden inflammation. We've talked about natural tools your body can use to heal: sunlight, real food, rest, minerals, love. But here's the most important thing. Your heart isn't broken. It may be tired, it may be inflamed, it may be grieving, but it still beats. It still listens. And more than anything, it needs you to understand what it's been trying to say all along. Not with fear, not with guilt, but with grace. Because the real medicine isn't in a pill bottle. It's in the way you eat, the way you move, the way you breathe, the way you live. Your heart is talking. Now, are you ready to answer? If this message spoke to you, if you saw yourself or someone you love in any part of this story, don't let it end here. Share it. Send it to a friend, to your parents, to your siblings, to the neighbor who lost their spouse. You never know whose life you might touch, whose heart you might protect. Sometimes it's one conversation, one link, one moment of understanding. That changes everything. So don't wait for a tragedy to happen. Give someone the knowledge that could prevent it. That's how we heal, together.